If you're struggling with knee pain and worried about needing surgery in the future, this video is for you. Most people don't realize that knee arthritis is not just about wear and tear. There's a 5-step process to manage your knee pain, keep your knee joints healthy, and in many cases, avoid surgery. In this video, I'm going to go into exactly what you need to do. Hi, I am Dr. Chris Cameron from Cameron Family Chiropractic in Lucan, Ontario. I specialize in non-surgical treatment for chronic knee pain, and over the last 25 years, I've worked with hundreds of patients who were told that the only option is painkillers, injections, or surgery. But once they learned to properly manage their arthritis, they got back to doing the things they love to do and going through life pain-free. So let's dive into the 5 steps you need to take control of your knee arthritis today. Step 1, we need to get inflammation under control. I can't stress this step enough because it is hard to do any of the following steps until you get the inflammation under control. This is why in the office we use deep tissue laser therapy and non-surgical knee decompression for many of the chronic knee pain cases we see. Inflammation is a huge problem for people with knee arthritis because when your knee joint is irritated, it swells up, it stiffens, and gets painful even when you're not using it. You might notice it more in the morning, after sitting for a while, or if you try to do a specific movement. When inflammation builds up, it starts breaking down the cartilage inside your knee. So the first thing we need to do is offload that joint and reduce the stress on it. That means temporarily using a deloading brace. I recommend using a brace that has metal bars and a hinge on either side of the knee. In some cases, a cane, crutches, or even a walker might be necessary. Even though you need to unload the knee, you also have to keep the knee moving in the right way. One of the best movements for this is something called a tailgate swing. Just sit on the edge of a chair and gently swing your legs back and forth. This gets the joint fluid moving inside your knee, which is critical because cartilage doesn't have a direct blood supply to it. That joint fluid is what delivers the nutrients your cartilage needs to heal. When your knee is swollen and stiff, it's like a sponge that's dried out. It can't absorb nutrients properly. Gentle movements like the tailgate swing help circulate that fluid and brings fresh nutrients to the joint, allowing it to start healing. The key here is low impact movement that doesn't cause extra strain on the knee. Step 2, we need to turn on the right muscles. This is where most people go wrong. When certain muscles around the knee are weak and turned off, the other muscles have to take over and create bad movement patterns that increase the stress on the knee joint. Over time, that excessive stress accelerates the arthritic process. The 3 muscle groups that tend to be inhibited in people with knee arthritis are the glutes, the lower abdominals, and the foot muscles. Now, your glutes are muscles in your butt that stabilize your pelvis and control how your legs move. When they are inhibited, your thigh bone tends to rotate inward, which puts extra pressure on the knee joint. The second area is your lower abdominals. They play a huge role in how to stabilize your pelvis. When the muscles are weak, it throws off your posture and makes it hard for your glutes to activate properly. And finally, the muscles of your foot are crucial for absorbing the impact when you walk. If your arches collapse when you step, your knees has to compensate, which leads to increased wear and tear over time. The good news is turning these muscles on doesn't require heavy workouts. It's a simple activation exercise when you consistently tighten these muscles to get them working again. Step 3, fixing the joint alignment. This is where things really start to change because when your knee is in the wrong position, even the strongest muscles won't be able to protect it. Think about it like this. Your knee doesn't function on its own. It's part of a chain reaction which starts in your feet and goes all the way up to your hips and core. If one link in that chain is off, the stress that gets dumped onto your knee joint. One of the biggest culprits is poor foot alignment. If your arch collapses When you walk, your knee automatically collapses inward, which creates excessive pressure on the cartilage inside the joint. Another issue is pelvic positioning. If your pelvis tips forward too much, it forces your knees to absorb more impact than they should. To fix this, we have to activate the receptors in the muscles of the pelvis so they do the job they're supposed to. This is done through a specific technique known as trigenics. It's not about doing knee exercises, it's about getting your entire leg and core working together the way they're supposed to. Step 4, strengthen the right muscles. Once we've turned on those weak muscles and improved your joint alignment, now we need to strengthen them so your knee doesn't have to work so hard. But here's where most people make mistakes. They focus on strengthening the wrong muscles. Most people with knee arthritis already have overactive quad muscles, the muscles on the front of their thigh. The problem is that when the quads take over, they pull the kneecap upward and compress the knee joint even more. Instead of focusing on quad exercises, we need to strengthen the muscles that support the knee, specifically the glutes, the core, and the foot muscles. If these muscles are doing their job, you won't have to take as much impact with every step. One of the best strengthening exercises is the glute bridge, which helps re-engage the glutes without putting stress on the knees. Another great one is the toe curls, which strengthen the foot muscles and improve arch stability. The stronger these muscles get, the less strain your knees will have to deal with over time. Step 5, maintain your strength and movement for the long run. This is the step most people forget about. A common mistake is people finally get some relief and stop doing the exercise and then falling back into their old habits. Arthritis is a long-term condition, and if you don't stay on top of it, your symptoms will creep back in. That doesn't mean you need to do intense workouts every day, but you do need to be consistent with keeping your muscles activated and moving correctly. Once you build a solid foundation, maintaining it becomes much easier. And the best part, when you get this process right, your knees start feeling better without injections, without painkillers, and without surgery. Let's recap the 5 steps to managing knee arthritis and avoiding surgery. Step 1, reduce inflammation and keep the joint moving with the right kind of low-impact exercises. Step 2, activate the muscles that are weak so your knee doesn't take on too much stress. Step 3, fix your joint alignment so your knee isn't absorbing all that impact. Step 4, strengthen the muscles that support the knee, like the glutes, core, and foot muscles. Step 5, maintain your progress and don't slide back into old movement patterns and let arthritis take control again. If you've been dealing with knee pain for more than 3 months and you don't know what the next step is, maybe it's time to take action. Click the link below to learn how we can help people just like you avoid surgery and get back to moving pain-free.